Welcome to Pate's Knowledge Corner. Congenital hand disorders. Babies born with hands that are different than the normal hand have a congenital hand difference. Millions of steps are required for a normal hand to be formed. A failure in any step will result in a congenital disorder. Some of these congenital differences are believed to be caused by a genetic cause, and others occurred because of unknown causes. Research efforts to further understand these problems are ongoing. Approximately 5% of babies are born with the congenital difference of the hand. There are many kinds of hand differences that present at birth, and each one of them can be treated differently. Depending on the type and extent of hand malformation, some babies may have little trouble adapting and functioning well. Others, however, may face various challenges as they grow and learn, which includes developmental problems such as delayed or deficient motor skills, difficulties with activities of daily living and basic self care skills, limitations on certain types of exercise and sports, potential emotional and social harm from childhood teasing about appearance. If child is functioning well and is happy, treatment is not always necessary. And if the child is having difficulty doing the things he or she wants to do because of a hand malformation, treatment options may be available. Types of hand malformations. There are many types of hand malformations. Here I am going to say few malformations which are most often seen. Extra digits, polydactyly. So polydactyly is the most common congenital hand deformity. A baby born with polydactyly has more than 5 fingers on one hand. An extra finger is often a small piece of soft tissue that can be simply removed. Sometimes the extra finger contains bones but no joints. Very rarely the extra finger is a fully functioning digit. A baby may be born with several extra fingers. There are different types of polydactyly. First is preaxial polydactyly. It involves having an extra thumb. Postaxial polydactyly. It involves having extra fingers on the opposite, that is the pinky side. Third, central polydactyly. Extra fingers can be located between center fingers, although this is less common. And the next type is syndactyly, that is fused fingers. This condition occurs when two or more fingers fails to separate when a baby is in the womb, resulting in webbed fingers at birth. It usually involves the middle and ring fingers. So here there are categories of the conditions. So number one, complete syndactyly. The skin is fused all the way to the tip of the affected fingers or toes. Second, incomplete syndactyly. The fingers or toes are joined only part of the way to the tips. Third, simple syndactyly. The fingers or toes are joined by skin and soft tissues only. Complex syndactyly. The bones of fingers next to each other are fused. Next type is Symbrachydactyly, that is underdeveloped hand. Babies born with Symbrachydactyly have small or missing fingers. They also may have webbed fingers or a short hand or forearm. In this, there are three types. Mild Symbrachydactyly. The hand has slight short, mobile fingers with minor webbing. The hand bones and some of the finger bones and the thumb are present. Second, moderate Symbrachydactyly. Most or all of the finger bones are missing, and the baby has small projections of skin and soft tissue. The thumb is usually present, but it may be short. And the third is severe Symbrachydactyly. The baby has either a partial thumb or no thumb and no fingers. And the next type is club hand. Babies born with club hand are partially or completely missing one of the two long bones that make up the forearm, that is the radius or the ulna. As a result, the forearm may be shorter than normal. The hands turn inward, causing limited range of motion at the wrist. So here there are two types: radial club hand. Children with club hand on the radial side, that is radial dysplasia, often have a short forearm and wrist curved towards the thumb side. Second, ulnar club hand. It can range from mild to more severe cases with the baby's wrist to be in a fixed and bent position towards the little finger side of the hand. The thumb may be deformed or absent. Next type is cleft hand. It is also known as ectrodactyly. Cleft hand is when the middle part of the hands develop abnormally. Babies with this condition are missing one or more central fingers on the hand. There are mainly two types: typical cleft hand, V shape, and usually missing or partially missing middle fingers. Both hands are usually affected and sometimes the feet are too. Atypical cleft hand. It is U-shaped and usually involves only one hand. Next type is thumb hypoplasia, which is also known as hypoplastic thumb, means that the child's thumb is unusually small or underdeveloped. Next type is triggered thumb. Pediatric triggered thumb is also called flexion contracture of the IP joint. It is a condition that affects the movement of the thumb in children. The thumb gets stuck in a bent, that is flexed position. Next is camptodactyly. Camptodactyly is a condition that causes one or more fingers to be permanently bent. Next, amelia, that is absent limb. Amelia is the birth defect of lacking one or more limbs. Next, adactyly, that is absent fingers. Macrodactyly, it is also known as megalodactyly of the hand. So it is a condition in which the child's fingers are abnormally large due to the overgrowth of the underlying bone and soft tissue. Treatment. The most important goal of any treatment for hand malformation is to help a child function as independently as possible. The treatment options are limb manipulation and stretching, splinting of the affected limbs, tendon transfers, external appliances to help realign misshapen fingers or hands, physical therapy to increase the strength and function of the hand, correction of contractures, skin grafts. These involve replacing or attaching skin to a part of the hand that is missing skin or has been removed during a procedure. Prosthetics. These may be used when surgery is not an option or in addition to surgical correction. Hands work, head feeds. Thanks for watching.